Well, the topic of testing is something that keeps coming up after the Supreme Court decided that every test for coronavirus across the country will be completely free of cost, both private and public sector. Uh, the private sector labs wanted clarification. Even though the Supreme Court had in fact said that the government would reimburse, it turns out that that's not enough. There needs to be more clarity from the government as to how that reimbursement is going to come in and what's going to happen. Effectively, between Dr. Kiran Majumdar-Shaw saying this will be detrimental to testing, this is something that's worried a lot of people across the country. Joining me right now in this conversation is Dr. A. Velumani, who is the founder and the managing director of Thyrocare, one of these large private sector testing companies. Dr. Velumani, thank you for speaking with me. Do you agree with Kiran Majumdar-Shaw that making testing free will actually be detrimental to the number of tests that we want to do in this country?
There needs a correction in that statement. Making tests free and asking the laboratories to bear the cost is detrimental to the entire COVID fight, because testing will not happen and the counts will come down, and we would be not having a data even to understand what is happening. What she meant is government should subsidize and all poor should get free, but laboratories cannot bear the cost of it. I think that is the message. She is not against giving it free. In fact, giving it free will increase the number of tests even at various segments in the society. And that is very well accepted. Even pathology laboratories are of that opinion. Poor should not pay. So that's a consensus. I think the Supreme Court hasn't truly damaged anything, except that it has directed the government to look into how to make it free for poor.
When we say government will reimburse, how is that not enough? Because what are the costs right now that you're incurring per test? And will a later reimbursement be an effective model? How would the private sector prefer to receive this reimbursement?
See, unfortunately, this test is not like the routine laboratory test where the raw material cost is less and you have sufficient margins and you can do a lot of back and forth adjustments. Incidentally, in this 4,500 permitted, approximately 40% is an imported component, which is the reagent. Now, these guys don't accept orders without an advance payment. So that is number one. Number two, the specimen to come from the patient home to laboratory table, it's a 30% cost in it. In fact, that is the big challenge in this COVID testing. So 70% is material cost. And this 70%, we need it even before the booking the test. And we can't afford to give a kind of 2 months, 3 months for government to pay, because that much cash resource no company has got, especially in a time when all the rest of our business have completely died off. We don't have the routine business as of today. So that is not possible for us to wait. Maybe more than a week, 15 days we can wait, nothing more than that. And government needs to help us that there will be an online payment as and when we submit weekly bills. Otherwise, we can't test it. We have to stop taking booking.
Dr. Velumani, the conversations that are happening on social media right now about how this is not a time for the private sector labs to be talking about money. They should focus on the greater good of the country and come out and test as much as possible. Would you like to respond to those comments?
It's almost like telling that no medical shop should charge, all medicines should be free, no kirana dukan should charge, everything should be free. I think it's a kind of immature talk people are doing. Mature people are not talking like that. But having said that, had it been a test which is having a raw material cost of 10% or 5% of the total revenue, it is possible that we can do it free of cost also. But in a test where 70% of the cost is only raw material, and the remaining 20% is the total cost of lab, floor, HR. Even our own staff also need salary. Is that anybody will work without salary? In fact, I want you to understand, the making the people to work in the COVID laboratory needs to be paid 2x or 3x if I have conscience.
Yes.
So to that extent, it is challenging. जो कह रहे हैं कहता ही जाएंगे. That is not a true worry.
There are, of course, we must explain to our audience the tests that are being done, the PCR test. Now, correct me if I'm wrong. This is when a swab is collected from the throat and from the back of the nose of of the individual. It has to be, this is the live virus that is then being handled by the person who's collecting the sample. The handling of the virus in the lab, everything has to be done within certain levels of safety. Which is, does that then include or exponentially increase the cost per test?
Yes, the challenge is the full protection gear costs roughly around 1,200 rupees. In the last 10 days, it has come to 1,000 rupees, but it was 1,200 rupees. And this 1,200 rupees PPE cannot be used if I collect blood from your swab from you, and if I go to your neighbor, I have to change it because you might be contaminated. Now that man may not be contaminated. So it has become a necessity for us to keep changing for every person a PPE, which says this consumable is roughly around 20% of the cost in the entire total value realized. To that extent, there is a huge stress. In fact, doing COVID testing is too stressful for everyone in the laboratory and the floor. So having said that, we have done successfully so far around 2,000 estimations, and we believe we have gained some kind of expertise in handling. And the cost of PP also has slightly come down due to high demand and low supply, too much of hoarding. Everything was costly. I have a reason to believe availability has improved.
Yes.
The costs also are coming down.
For the healthcare professionals, you said yourself, who are putting their lives on the risk, on the line, and they're doing this work every day. So doctors, nurses, ward boys, pathologists, all of these people. Do we have the ability right now to test them once a week, twice a week, to make sure that they're safe, given the fact that they're constantly being exposed? What level of testing are we doing for our healthcare professionals right now?
In fact, I must tell you, they are an unfortunate and ignored lot. And we don't know how many of them have got exposed, how many of them have safely passed through, how many of them had mild symptoms and managed it. We still have no knowledge about it. But having said that, if you look at the general population and healthcare workers who are into the core virus area, if in general population, if it is 1 in 10,000 positive, in healthcare workers, it will be 1 in 100. So who need to be tested is first the healthcare workers. But whether the hospitals can afford to do it, or the hospitals doing it, is not very clear. Some of the hospitals in Mumbai have got a part of their tests, staff's test done. Not all hospital, but they may be giving to our other peers. We have no knowledge, but there is a likelihood some responsible hospitals have done a kind of screening.
Dr. Velumani, thank you so much for talking to me, and I hope that we can continue to have conversations as India continues to
Thank you.
COVID-19. Yeah, Dr. Velumani of Thyrocare. Thank you.